Hi, I'm JC. This is my adaptive equipment project. For my project, I chose a cutting board with a pivot knife. I'll show you what it is. This is what it looks like. The knife moves and lifts up. So the knife, as you can see, is connected to the cutting board at the tip of the knife. It has a special design on it that allows the knife to pivot without actually leaving the board itself. This piece of food preparation adaptive equipment performs well for those who have tremors, upper extremity disabilities, usually like the use of one hand, grasping or fine motor disabilities. So for my first diagnosis, I chose a patient with mild muscular dystrophy. Muscular dystrophy is when the body lacks dystrophin, which causes deterioration or weakness in muscles, and it causes a lack of muscle coordination. This cutting board will aid in lifting of the knife. So since it is connected to the board, it doesn't have to be fully lifted, just moved up and down. Like the stroke and Parkinson's disease that I will discuss further on, it helps with the prevention of like dropping the knife, accidentally knocking the knife off of the table or off the cutting board, and ultimately lessening the likelihood of injury. For my second diagnosis, I chose Parkinson's disease. Parkinson's is a neurodegenerative disorder that interferes with the neurons in the brain that produce dopamine. This causes the body to tremor. So this tool right here, the cutting board, helps ultimately with the steadying of the knife, and like muscular dystrophy and the stroke, it helps with prevention of a knife dropping or accidentally being knocked off of the cutting board, and ultimately lessens the likelihood of the chances of injury. For my last diagnosis, I chose a stroke. Patients who suffer from a stroke often suffer from two different causes. There is a ischemic stroke, which is the blocking of an artery, and there is a hemorrhagic stroke, which is leaking or bursting of a blood vessel. And most people who have strokes suffer from partial paralysis or full paralysis. This cutting board can aid in the cutting of food by allowing the patient who has suffered from a stroke to efficiently cut the food or whatever they're cutting without using full use of both upper limbs. It can do full use of the right hand and partial use of the left hand, or either or. This also prevents accidental injury from falling or dropping of the knife, just like the other two diagnoses that I have done in this presentation, ultimately leading to lessening of the chance of an injury. So to use the cutting board with the attached knife, simply place it on a stable counter, table, anywhere that is sufficient, anywhere that's accessible to the patient. The patient should hold the knife, hold it with my left hand, should hold the knife by the handle in a proper way. So on this knife, I put a cover on it in case there's any accidental slinging. When picking up the board, there is a cover on it. Safely remove the cover, and the patient should hold it by the handle, again, in a proper way, like this. The knife swivels like this, up and down, side to side, with easy access for cutting objects like this apple. It simply goes up and over. The knife simply needs to be lifted, moved to the object, and using the knife to cut the object by simply placing the correct amount of pressure onto, for this example, the apple. So for the first diagnosis that I talked about earlier on in the video, I chose muscular dystrophy. Muscular dystrophy is, like I said earlier in the video, a disorder when the body lacks dystrophin. This in turn causes degeneration or weakness in muscle coordination or muscles. So for this example, my left arm is going to be the one affected. So I'm going to take this off real quick. So with muscular dystrophy, there's going to be weakness in this hand. It's maybe contracted. So holding it like this, I'm going to be able to steady, since it is attached to the cutting board, I'm going to be able to steady it more. And let's do that. And I'm going to be able to have a steady cut. It is small, but it is sufficient for those who are trying to meet their culinary needs or just doing it for fun, for occupational therapy. For the second diagnosis that I mentioned earlier on in the video, I chose Parkinson's disease. Parkinson's disease is a neurodegenerative disorder that interferes with the neurons in the brain that create dopamine. This in turn has other effects other than tremors, but tremors is the one I'm focusing on today. So a person with Parkinson's, not always, but more than likely, they will tremor. So their hands will tremor like this. Their body will tremor. This allows a more steady movement of cutting. If you look, tremoring, but it's not, it's staying in the same place. It's allowing me to cut easier because I have more control with the knife. So as you can see, this would be a very effective piece of adaptive equipment for someone who is suffering from Parkinson's disease. So for my last diagnosis, I chose a stroke. A patient suffering from a stroke has suffered from one or the other when it comes to ischemic stroke and a hemorrhagic stroke. An ischemic stroke is a blocked artery, and a hemorrhagic is a leaking or a busted blood vessel. So this in turn causes partial paralysis of one side of the body. For this example, my left side of the body will be the one that's affected. This tool right here aids in the cutting of, right now, this apple by allowing me as the patient to cut this apple without fully using both extremities with the full use. So say I'm drooping right here because of the paralysis, I can simply scoot the apple over without actually holding it and simply cut into the apple because of the full control that is in this. And it, with all the other diagnoses along with the stroke, this is going to help. There is no dropping of the knife. So this allows for the lessening of the likelihood of being hurt from a dropped knife or a knife that's been knocked off of a counter or something like that. So on the website that I was inspired by to use this, it was called therightstuff.com, and it retailed for $96. This was made, I'll let you look at it. This was made with a total of $7. It's a very effective piece of equipment. It can be used for far more than Parkinson's, patients who suffer from a stroke and muscular dystrophy. It can be used for a wide variety of more things that I haven't discussed. But this equipment is very useful.